It is that time for the Rush Hour Roundtable. Today I'm joined by NewsNation's Ashleigh Banfield, host of Banfield. Robby Soave is co-host of Rising on Hill TV. Kristal Knight is a political and social impact strategist. And Jason Rantz is the radio host of the Jason Rantz Show based out of Seattle. So our first topic on this Friday, it's a new CDC study about the pandemic's effects on young people. About 8,000 high school students were surveyed. 44% of them reported feeling sad or hopeless almost every single day. And slightly more than that, 45% said they've had trouble concentrating, remembering things, and making tough decisions. So our big question today, did COVID restrictions do more harm than good? We want to hear first what everyone has to say. Ashleigh, did they do more harm than good here?
Well, let's just say that I'm glad that they are alive to have those feelings. That's a great thing. I'm also really glad you're asking me on a Friday, Nicole, because Friday's garbage day at my house. And I talk to my garbage man every Friday. His name's Silvio, and he was looking tired today. And I said, why? And he said, oh, because I'm doing so many shifts. 9 people died in our company, in our division. The drivers, 9 died of COVID. So we're all trying to make up for it. So it's a bad day to me to be asking, are masks a problem?
All right. Well, so Robby, we heard what Ashleigh had to say there, but did those restrictions, did they do more harm than good? Seeing what those teenagers are saying.
I think they did do more harm than good. There are certain COVID interventions that have been wonderfully helpful. The vaccines have absolutely saved lives, and I encourage everyone to get one. But there's a certain blind faith in masks that people have. I think people should absolutely wear them if they want to wear them. No one should be prohibited from wearing them. But forcing children who are not in great danger from COVID anyway to mask all day in schools while nobody else is really forced to do that anymore seems wrong to me. I live in D.C. There are still schools where kids are forced to wear masks for 8 hours a day while they're at recess, while they're engaged in sports. It makes no sense to me. I don't see how anyone could say that that's doing more good than harm. Well,
in addition to the masking, of course, there was the at-home learning. A lot of kids weren't able to even go to school. So, Kristal, what do you think? More harm than good done?
Well, I'm thinking about how many Americans have already died from COVID. And so there are over 700,000 Americans in this country who died. And so I think the restrictions were helpful in saving lives. I think as it relates to children, there are some good and bad in that, people or children haven't been able to have that in-person learning that they've been able to have in the classroom. And so in that respect, it has been more challenging and it has been more harmful. But when we think about the whole of America, it has been helpful.
So Jason, what do you think? I mean, more harm here done, or was it worth it?
I mean, overall, there was more harm that was done. Restrictions certainly helped, and certain policies and mitigations helped the people who were the most vulnerable. Unfortunately, it was done at the expense of the least vulnerable to COVID. And the fact of the matter is, we kept a lot of these restrictions in place despite data showing that they weren't, in fact, working. And that, I think, at the end of this is the most catastrophic part of the story.
All right, so I want to show some other statistics right now. So according to this same survey by the CDC, 19% of these high schoolers say they drank alcohol at least one day during the month before the survey. Again, this is high schoolers. 13% say they currently use marijuana. 10% report taking prescription pain meds without a prescription. We also know by the end of the 2020-21 school year, students were on average 5 months behind in math, 4 months behind in reading. Again, these are just averages. So we want to try to move forward, though. Looking forward, what have we learned from this and seeing these statistics, hearing these responses from these teenagers? What have we learned, especially if there is another pandemic? Ashleigh.
Well, I don't know that I could immediately point to them drinking because they, had to wear masks. That just seems a bit nutty to me. But I sort of just can't understand why everybody's so pro-death now. Wearing a mask is not the end of the world. And it's really frustrating to see that something so simple that could have a sizable effect on an unvaccinated population to start with, because we didn't get vaccinations into these teeny weeny arms for quite a while, certainly could save a lot of teachers and could save a lot of parents too. Sure, is there a downside to wearing a mask? Does it make you feel a little different? Do you not get to see,
but Ashleigh, isn't this more about the
communication?
lockdown? This isn't really about masks, right? This is about the lockdown and the effect on the teens. And Jason, I saw you react when Ashleigh said pro-death there. So what do you have to say?
Yeah, with all due respect, it's ludicrous to claim that people are pro-death because they happen to have a disagreement on a policy prescription. I think that we could look at the data and come up with slightly different perspectives without wishing people dead. I simply just reject that idea. At the end of the day, we do know that there very clearly was a negative reaction from teenagers in particular, but kids especially, because not just masks, but being kept home from school, being put in front of a camera, a webcam, a screen all day, and not having the same supervision that they normally would, and certainly not having the same time outdoors with their friends. We know, for example, going outdoors is incredibly safe. It's almost impossible to catch COVID outside. And yet, even after we knew that data, even if we had all of that, we told kids that they still couldn't go outside. We closed parks and beaches. That has real world impacts on those kids. And someone who's in favor of those policies, I don't say, well, you're in support of keeping kids indoors so that they're depressed. I don't think that that's a good faith argument.
You know, and Jason, you mentioned not being able to go outdoors, different things that we just didn't know. There were a lot of things we didn't know when this started, but now we've learned so many things.
I'm glad that Jason has such incredible,
but no, so the thing is, though, that's the question.
We didn't know
what
this
have we
stuff.
learned?
This was a
How
learning
do we
curve,
move
right?
forward?
It's 2 years of learning.
But how do we move
to
forward,
suggest that it was
Ashleigh?
wrong to keep kids home is nuts. Everybody was learning all the way along. And I think we move forward incrementally, as we have been. We've been dropping a lot of the restrictions slowly but surely. And with the most vulnerable, we've been careful.
Too slowly.
We found that for you, perhaps, but maybe for Silvio and all the dead drivers, maybe not. But I do think that as we do this, again, the most vulnerable, we started to see kids getting infected. Different strains did different things. And by the way, there are new strains coming. And we're not exactly sure what that's going to do. So slow and cautious and careful, I've never seen that as, the wrong thing to do.
All right, well, we're going to switch gears now. Thank you for watching. Click the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.